Health Today is brought to you by Caribbean Alliance Insurance, agent represented by BGI Insurance Limited.
September is Gynaecological Cancer Awareness Month, and in this edition of Health Today, we take a look at below-the-belt cancers. It's an issue that nobody likes to talk about. In fact, the silence is deafening. But every year, thousands of women are diagnosed with below-the-belt or gynecological cancers: cervical, ovarian, uterine, vaginal, and vulvar.
These 5 cancers actually account for nearly 20% of the 5.1 million estimated new cancer cases and contribute to nearly 3 million cancer deaths worldwide. So even though they only contribute to a small fraction, 20%, they end up causing 60% of the mortality associated with cancer worldwide. And it shows the gravity of the situation.
That's gynecologic oncologist Dr. Vikash Chatrani, who is urging women to take charge of their health. Delivering a presentation on cancers below the belt recently, Dr. Chatrani notes the risk of developing these cancers increases with age, but he cautions that young women can also be affected.
I have treated a patient with cervical cancer as young as age 9, and a patient with vulval cancer as old as age 95.
Of the 5 below-the-belt cancers, cervical cancer is number 1 in Barbados and the Caribbean. In Barbados, about 40 women are diagnosed with cervical cancer every year, and according to Dr. Chatrani, it costs $1.7 million to provide treatment. He insists there's no reason why women have to die from cervical cancer.
If you have free access to health care, you should be able to screen for these diseases early, pick them up early, and prevent cancer. Cervical cancer is a cancer that can be prevented. And that's, I don't want to use the word amazing, but that's an amazing thing about cervical cancer. We can actually prevent it. And women shouldn't be dying because of this disease. And we are fortunate in Barbados with easy access to free health care and screening services, at least for now. Women can get pap smears free of charge. And the beauty about Barbados is leading the way in the Caribbean with the implementation of the HPV vaccine to our girls entering secondary schools.
There are common symptoms women can look for, including abnormal bleeding or discharge for more than 2 weeks, pelvic pain or pressure, abdominal pain, back pain, and bloating. But he believes the growing incidence of the disease can be contained if women get the HPV vaccine, which has been treated with much skepticism and strongly criticized in some cases. He debunks myths about the side effects of the vaccine, pointing out that over 46 million people have already received it.
They found a virus called HPV to be responsible for over 95% of cervical cancer cases. And how do you get this virus? From skin-to-skin contact. Some of you may be saying, why should I care about HPV? Not me. I've had a single partner my entire life. It has nothing to do with the number of partners. They've actually shown that over 80% of the population would have acquired HPV at one point in their life. But this virus, you have an immune system, and your body has the ability to get rid of the virus. So all HPV infections doesn't cause cancer. There are over 140 different types of HPV, 40 of them more located down there below the belt. And out of these 40, only some are high risk. Why I say that? Because some are low risk and cause things like warts. And we don't know which type of HPV you will have, whether yours will go to cancer or whether yours will get better, until now. There are tests that we can do where we can actually start testing the type of HPV infection.
With respect to the other 4 below-the-belt cancers, ovarian, uterine, vaginal, and vulvar, Dr. Chatrani advises women to pay attention to their bodies.
Know the signs and symptoms. And as I told you, bloating, feeling full quickly while eating, these signs and symptoms have to be present for more than 2 weeks, because if you eat quickly and you eat a lot, you're going to feel full, okay? Pelvic or abdominal pain, going to the bathroom to pass water more often, unless you seek medical advice. It could be something like diabetes, it could be a urinary tract infection, it could be other things, but you need to get medical attention to be able to know what it is. and then bleeding or back pain. That's ovarian cancer. See how quick that was? Now, uterine or womb cancer. This is a schematic diagram of how it looks. You remember what I told you to look for? Bleeding after the menopause. Anybody who has bleeding after the menopause, for those men who don't know what menopause is not when you put men on pause. Menopause is when you stop having a period for 1 year, okay? So if you stop having a period for 1 year, women, and you have bleeding from down below, go to your doctor. Vaginal cancer is very rare. When you go and get your pap smear, your doctor will be able to assess the vagina too as well, and see for any growths or any lesions there, and your pap smear may actually pick it up. And then vulval cancer, cancer of the lips, usually present in the elderly. My youngest patient with vulval cancer was probably 69. My eldest was 95. They usually have itching and a persistent lump, and they keep scratching at it. They think they scratch it too hard, but if it doesn't go away after a couple of weeks, go to your doctor. It may be an early sign.
The doctor stresses that the best cure for cancer is prevention.
If we can prevent the disease rather than curing it or treating its symptoms, I think that's the best bet at winning the fight against cancer. And prevention involves taking a visit to your doctor. So in these times, the apple a day to keep the doctor away will no longer work, okay? We need to visit our doctors.